Namaste. Today we are going to take a look at a very hot topic in today's science, that is of psycho-neuro-immunology and psycho-neuro-endocrinology. This has become a very hot topic because finally we in science have realized that how you think, how you emote, what you think and what you emote can influence your body responses, especially with regard to the immune system. Now, the center of all of this is primarily your hypothalamus. And often in the scriptures we talk about the hridaya, and people only think of the physical heart. But I often like to think that the heart of the human being, the heart of our existence, at least at this level of existence where we are surviving, is primarily the hypothalamus. Because it is through the hypothalamus that the endocrine system, the immune system, and the autonomic nervous system can all come together and influence our homeostatic, salutogenic well-being. The hypothalamus is in the center of the brain and surrounded by the limbic system. Now you know the limbic system is to do with our emotions. And the moment your emotions get moving, they just go faster and faster and faster and faster. And imagine this poor hypothalamus in the center of all of this, getting constantly shouted at, hey you, thou, this, like that. And what happens? The hypothalamus starts to go off its normal rhythm and it starts to work downwards. Now in health, this system is working excellently well. Your hypothalamus influences the pituitary. The pituitary then can go down to influence the adrenal glands, your gonads, your thyroid, and then they go on to influence your immune system, especially through the immune cells, the thymus, the bone marrow, the lymph nodes and the spleen. And this gets regulated by the hormones secreted by these endocrine glands. For example, thyroxine from the thyroid, the cortisol and other glucocorticoids from the adrenal cortex, and of course estrogen, progesterone, testosterone and DHEA from the gonads. So all of this is fine as long as we are in a normal, healthy, homeostatic equilibrium. Along with this, the hypothalamus influences your sympathetic nervous system. We have the parasympathetic nervous system. Primarily, our influence is through the vagus. And we have the neurochemical transmitters, especially the cytokines that are giving feedback from down above and the CNS cytokines from up down. So a very beautiful, intricate meshwork where your nervous system, your endocrine system and your immune system are functioning as required by each other. When one needs some help, the other goes to give it, and when the other needs it, the third one comes together and they work on influencing each other in a very positive manner. But now what happens? Stress comes in. And we have already seen how stress is primarily how we perceive the world around us and how we perceive the changes happening in the world around us. It may be a physical change, it may be a psychological change, a physiological change, an emotional change, a social change, a financial change, or even a spiritual change. When there is change outside and in the environment with which we are interacting, and if we are not able to adapt to that change, how we perceive the change, how we adapt to it, and if we feel comfortable, competent, and on top of the issue, we don't feel stress. But most of the time, because we perceive a molehill as a mountain, and especially when it comes through the prism of our kleshas, immediately whatever happens to us is the end of the world. because we are the world. And because of the lack of metacognition, vairagya, because of the lack of discernment, viveka, that is the prefrontal neocortex functioning, we start to hyper-react, overreact. And instead of response to the stress, we start to react to it. And in that hyper-reaction, all of this starts to go haywire. And what starts to happen? Initially, a little bit of stress. It is called eustress. What it does is, it starts to tone up your immune system. And in fact, a little bit of stress helps you respond better, your immune system to respond better. But then, as you start to pour more and more and more stress, and more and more and more of these hormones and neuropeptides and neurochemicals start to go into your system, your whole system starts to shut down. And that is why we find when we have all these different emotions, grief, anxiety, guilt, and especially the suppressed emotions, because in society we are told we have to be very dignified. We have to maintain our semblance of calm, of normalcy. We are expected to be something we are not. And because of that, we suppress and repress our emotions. And as that goes in, it starts to affect the hypothalamus in a negative way. That affects the anterior pituitary in a negative way. That in turn affects the thyroid, the adrenal, the gonad in a negative way. And through the nervous system, the musculoskeletal system, the cardiovascular system, all the systems get involved. You end up with, say, a condition like migraine. So when someone has migraine, it is not just about a pain in the head because of changes in the vasculature. But we need to go to the root source. We need to understand the adi behind the vyadi. If we don't do that, we are just giving symptomatic management. And symptomatic management using yoga techniques and concepts is what I call yogopathy. If you want to work with yoga therapy, you want to work with yoga chikitsa, we need to understand the psycho-neuro-immunological, psycho-neuro-endocrinological correlates that are lying behind what is manifesting as migraine. It may manifest as any condition. It may be a heart attack. It may be a stroke. It may be diabetes. But behind it, what are the psychosomatic stress-related correlates? All these conditions, the psychosomatic stress-based conditions, all of them go through the stages of the psychic, the psychosomatic, the somatic, and then finally the organic. So what we are seeing as an organic condition is having behind it the psychic, psychosomatic, and the somatic component. And especially if we don't deal with the psychic and psychosomatic, we are not going to get a permanent solution. And this is why it is essential to understand that our behavior affects the brain, the nervous system, the immune system, and the endocrine system. And until and unless we change our behavior, and that is why in yoga therapy, in yoga chikitsa, we talk about changing the lifestyle. Ahar, vihar, achar, vichar, and vyavahar. How do you eat? How do you relax? What are your activities? What are your relationships? All of these are important. Because unless you change yourself, unless you change the way you perceive the world around you, you are not going to gain control. You are not going to become the master of the condition and will always be the victim of circumstances. The science of psycho-neuro-immunology and psycho-neuro-endocrinology enables us to understand how yoga chikitsa can help us in reclaiming our health and happiness, our birthrights, as my father and Guru Swami Geetananda Giri would tell us. Let's change ourselves. Let's change the way we perceive the world. And at that point, we can reclaim our health and happiness.